Monkeypox primarily occurs in the Central and West Africa. It is a self-limited virus with the symptom lasting from 2 to 4 weeks. Severe cases can occur in recent time. The case fatality ratios had been around 3 to 6%. Yung clinical presentation ng virus na to resembles siya with smallpox. Yung smallpox na eradicate siya worldwide in 1980. The vaccine that is being used in smallpox eradication program also provide protections against monkeypox. A newer vaccine had been developed on which one had been approved for prevention of monkeypox according to the World Health Organization. So this is a zoonotic disease and it can be transmitted from animal to human. So thank you for watching. Hello there. I hope you're going to finish naman my videos. You will learn something more on the transmission, the disease, its causes, how it's transmitted, some of the course of the disease, the sign and severity of symptoms, complication, and prevention. Stay with me. We're going to discuss more on monkeypox. So let's talk about the mode of transmission. It is being divided into two. This is an outbreak from primary infections to secondary infection. The primary infections is animal to human transmission through bites or scratch and direct contact sa body fluids or bush meat preparation ng infected animals or eating inadequate cooked meat. Secondary infections is human to human transmission. One possible transmission or yung pinakamataas na transmission is through respiratory droplet infections, but this requires naman prolonged face-to-face contact, kaya at least yung mga health workers, yung household members, and other close contact of active cases. So if you have an open wound and you nakatouch ka dun sa mga contaminated materials, possible din ang portal of entry through mucous membrane, through eyes, nose, and mouth. And also transmissions via placenta from mother to fetus, which can lead to congenital monkeypox. Ang highest possible chances kaya dumadami yung cases is mas madali siya mag-transmit sa mga kasama sa bahay because of contaminated linen or clothes, direct contact on the lesion without wearing any gloves, and sharing of bedrooms and utensils. So yung close physical contact is a well-known risk factor for transmission. It can spread between people primarily through direct contact with infectious sores, scabs, kayong body fluids. Yung monkeypox kasi can spread out during intimate contact between people, including yung kissing, cuddling, touching parts ng body na may monkeypox sores. At this time, it is not known if monkeypox can spread through semen or vaginal fluid. So that is the updates on the mode of transmission. So let's talk about the disease progression. So disease progressions, it is being divided into 4 stages. Yung first stage is the incubation period, that is 5 to 21 days. The patient usually wala siyang symptoms. So, nag-start yung incubation period from the day 1 na ma-expose siya sa infected animal or human. So, during that time, it would depend on the immune system ng isang patient. Pwedeng as early as 5 days, meron na siyang symptoms, or later, kasi 5 to 21 days. So, ibig sabihin, dun pa lang nagmumultiply yung virus sa loob ng katawan ng patient, at pag immunocompromise ka, mas mabilis. So, pag mataas yung immune system mo, pwedeng tumataas na yung number ng virus mo sa loob ng katawan, pero wala ka pa ring manifestation, which is on the stage 2. Ang stage 2, which is 1 to 4 days, febrile stage, doon nag-occur yung lagnat, fever, lymphadenopathy, or presence ng lymph node that common in the back of the neck or sa may front, in the armpit and inguinal area. And the patients may complain headache, chills, sore throat, malay, and fatigue. Sa 2 to 4 weeks na rash stage, yung next stage siya, yung third stage, lumalabas na yung mga rashes sa skin. Ang tawag dito is centrifugal distribution. Patients may complain painful and itching, and it is more on face and limbs rather than sa trunk, but it may appear in the palm and also in the sulfate. Yun yung pathognomonic symptoms niya and difference niya from smallpox or chickenpox. Meron siya sa palm at sulfate at may presence siya ng lymph nodes. So the virus is already in the bloodstream dito sa stage na to, at yung small lesion in the mouth may appear on the towards the end. Ang tawag natin dun sa lesion in the mouth, that is enanthem. And in 2017 and 2018 data gathered from some cases in Nigeria, it can also appear in the mucous membrane like inside the mouth, conjunctiva, and cornea. That is why I make some emphasis on the mode of transmission in the mucous membrane, sa mouth, sa eyes, and sa nose. Now, question. During the disease progression number 3, does the patient is contagious? Ano po yung sagot nyo? Yes, the patient is contagious sa rash stage. Why? Because the virus is present in the skin lesion. So, nandun na siya sa crust, nandun na siya sa liquid or fluid na lumalabas sa mga sugat. Antibodies is already produced and become detectable during blood chemistry. So, even yung patient, nasa recovery period na siya at wala siyang sign and symptoms na days to week, pero mayroon pa siyang mga dry skin, flakes, and crust. So, ibig sabihin, contagious pa rin yung patient. At yung kanyang mga linen, bed linen, lahat ng materials na ginagamit niya is possible na contaminated. So, what are the possible complications? Corneal infections and vision loss, secondary bacterial infection, abscess, and airway obstruction, pneumonia, bacterial infections of the blood, or what we call sepsis, inflammations of the brain or encephalitis, miscarriage, and death. Yung long-term consequence of monkeypox is scary. Marami siyang scars na makikita sa skin, nag-reduce yung skin pigmentation, and possible blindness due to corneal infection. So according to the CDC interim clinical guidance for the treatment of monkeypox, sabi nila many individual na affected ng monkeypox virus have a mild self-limiting disease course in the absence ng specific therapy. However, the prognosis of monkeypox madepende siya sa multiple factors like initial health status, yung concurrent illnesses, and comorbidities. So there are persons who should consider for treatment. Person with severe disease, yung may mga hemorrhagic disease, sepsis, persons who may be at risk for severe disease, yung may mga immunocompromised, patients with malignancy, organ transplantation, and also pediatric populations, particularly patients younger than 8 years of age, yung mga pregnant or breastfeeding women, and persons with one or more complication. So these are the persons that needs to be considered for treatment and consultation. According to CDC, there is no specific treatment approved for monkeypox virus infection. However, antiviral developed for use in patients with smallpox that may prove beneficial. Some of the medications that I'm going to discuss or mention are already in my first video, like the tecovirimat, also known as Tipox, cidofovir, also known as Bestide, brisidofovir, which is known as Timbaxa. So these three antiviral medications that is approved by the United States Food and Drug Administration, or FDA. An immunoglobulin intravenous known as the Basinia immunoglobulin intravenous, or VIGIB, used for treatment of monkeypox. And of course, the vaccine that is being used for smallpox eradication is approved by the World Health Organization. The purpose of this video is for public awareness and how we're going to prevent the transmission of monkeypox virus, what to know, So let's start with avoid unprotected contact with infected persons and or animals. Meaning to say, pag infected ang isang member of the family at naka-isolate at tayo ay yung nag-aalaga, we need to wear at least gloves and face mask. We need to observe the proper hand washing. We need to protect ourselves. Kung may complete na PPE or personal protective equipment, much better. We need to observe hand washing frequently with soap and water after caring of infected persons or animals. It is very important na since direct contact again, even siguro wala kang direct contact pero dun sa place kung saan ka na-expose at contaminated yung area, we need to observe hand washing. Another one is do not share clothing and beddings, towels, and utensils with a sick person. We know that even yung kanyang body fluids, so even yung mga materials na ginagamit, yung kanyang beddings, dun sa kanyang bed, is possible it contains virus. We need to avoid contact with wild animals, especially found sick or dead. We need to isolate the infected person or animals. We need to use personal protective equipment or PPE when caring infected patient. We know the mode of transmission, so the PPE is very important to protect ourselves and prevent the transmissions of the virus. Thoroughly cook all foods containing meat of infected animals, since the primary infections is animal to human and includes the body fluids of infected animals. The set of criteria for identifying cases of the disease or the case definition coming from the World Health Organization. Pag sinabing suspected cases, yung mga patients may fever above 38.3 degrees centigrade, may headache, lymphadenopathy, back pain, myalgia, distinctive and progressive rash, including on hands and feet. Pag probable case, ibig sabihin na expose siya sa infected patient. A suspected case with an epidemiological link to a confirmed case or another probable case. Pag confirmed case siya, ibig sabihin nun, positive na yung laboratory results. So that is the updates on monkeypox. Thank you for watching. I hope you learned something on my presentation. I hope you like the discussion. I will make another video. I hope you're still there. Please like, subscribe, and hit the notification bell. I'm your nurse on duty. Maraming salamat.